A very good afternoon to you. My name is Mark Drax on behalf of SASH. And this afternoon I have the great pleasure of talking to Jerry Law, who works at The Meadows near Phoenix in Arizona. A very good afternoon to you, Jerry.
Good afternoon to you, Mark. It's a pleasure to spend some time with you, and hello and welcome to everyone watching.
Thank you very much. How is life in Phoenix?
Life is good. We are just on the hopefully tail end of the hottest summer we've ever had. We've had 53 days over 110 Fahrenheit, 110.
53 days.
Now that doesn't count the 108 days. So we're quite ready for summer to come to an end.
Wow, Jerry. In England, we get excited if it goes over 100. So for once a year. So
we're accustomed to 100, but 110, 115, that gets really tough.
That's great. Well, thank God for air conditioning. What did the Indians do before air conditioning?
I have no idea.
Well, Jerry, look, we've got a few questions to chat to you about, and this is a lovely opportunity for you to tell everybody about the Meadows. So I'm going to shoot on, if I can, I've got 6 questions here for you.
Absolutely.
Fabulous. Well, look, the first one, very simple. Let's kick off with, what do you think makes the Meadows unique in the mental health industry?
Yeah, that's a great question. And let me give you a little bit of background. Meadows Behavioral Healthcare actually has 5 residential treatment programs and our Rio Retreat Center, all in wonderful Wickenburg, Arizona. And Wickenburg is about an hour northwest of the Phoenix Sky Harbor Airport. I have the pleasure of being the executive director over 2 of those 5 programs, those being Gentle Path and Willow House. And what really makes us unique at both of these programs is our absolute laser focus on compulsive sexual issues, sex addiction, and all of the related aspects they're kind of hand in glove with sex addiction. The program, our Gentle Path, is a gender-specific program for men. Willow House is a gender-specific program for women. And so we very decidedly keep those populations apart so that we can really focus in on those core issues. A couple of things that really make us unique. Number one is that the curriculum at both of these programs were created by Dr. Pat Carnes and Dr. Stephanie Carnes. And as many people know, Pat Carnes is considered the foremost authority on the treatment of sex addiction in the world and really in history. His 30-task model that he developed nearly 50 years ago is the cornerstone of what we do. And so it's all about that Carnes model. And Pat Carnes continues to serve as a senior fellow and consultant for our Gentle Path program. Stephanie Carnes continues to be a senior fellow and consultant, more so at Willow House, but also does some work with Gentle Path with both patients and staff. So the Carnes 30-task model is the real core of what we do. Secondly, we have what we call the Meadows model. And this is a program or a model that was really developed by Pia Melody, who continues to provide services as a senior fellow in our programs. And the Meadows model is all about trauma. Many programs refer to themselves as trauma-informed. I like to say we are trauma focused. We are strong believers that underneath addictive disorders, mood disorders, anxiety disorders, PTSD trauma, it is that trauma piece. So while a patient is with us, we're a 45-day residential program. And while they're with us, they're going to go through what we call Survivors Week. And this is really a Meadows hallmark. It's that deep dive into the trauma. In particular, a childhood trauma, adolescent trauma, the trauma that happened in these individuals' lives when they were too young to really even know what to do with it, and how that trauma has impacted their lives on an ongoing basis. So we really dig deep into that trauma and provide some healing, some tools for dealing with that trauma going forward. So between the Carnes model and the Meadows model, patients who come into these 2 programs are getting a lot of work.
Jerry, thank you. I'm going to let you in on a little secret. I've been to the Meadows as a patient, not residential, but I came there in August 2007 for a week. And I think I worked with a lady called Barbara. I may be wrong, but I think she was called Barbara. Had an incredible week doing the sort of laser surgery workshop called, I believe, Men's Sexual Addiction.
Yes.
And it was incredible. It was life-changing at the time and helped me enormously. So to now be what I believe is in some pretty good recovery these days, and to look back at some of the challenges I've had since I came to you, and to hear you talk of this now, I think the whole focus of the industry on trauma is critical. And so it's lovely to hear you talk about that. And thank you so much.
I couldn't agree more, Mark, and congratulations on your recovery journey. I'm one too. So, recovery is the best, it's just wonderful. So imagine that week workshop 6 times over. It's a 6-week cycle. So we're able to really go deep.
Well, Jerry, I can tell you today that I actually needed that in 2007. I just wasn't ready for it. I thought a week was enough. I needed 6. But there we go. Benefit of hindsight. Huh?
Yeah.
Jerry, thank you.
You bet.
Listen, let's talk about question number 2. How has the Meadows changed over the years, and what do you think keeps the Meadows relevant?
Yeah, that's another great question. The Meadows, what we call main campus, the Meadows, has been operating now for 45 years. One of the oldest residential treatment programs in the country, and just very, very successful. We stay true to that mission. We stay true to our core values. We don't chase the latest anything, though we do stay current. We have a whole cadre of senior fellows. I mentioned Pat and Stephanie Carnes. We have Dr. Kevin McCauley, Dr. Bessel Vanderkoop, Dr. Peter Levine, this whole cadre of senior fellows who are on the cutting edge of research. And these are the folks who come in and really keep us fresh and really keep us current, so that we're constantly staying, I'd like to say, ahead of the curve, while at the same time staying absolutely true to our core values. So, the fundamentals are not going to change, but we're going to stay very informed on the latest and the greatest, embracing medication-assisted therapies and other protocols that are evidence-based.
Listening to you quote your senior fellows, anyone that understands the mental health industry, and for those of you who don't, trust me, that is an impeccable, the best cadre of fellows you could possibly. That's a very impressive list of people. Peter Levine, Bessel Vanderkoop. I mean, these are the people that have been driving the whole understanding of trauma for several decades.
Yes.
So to have those in your camp is very special.
It truly is. And the beauty is, as I've met these individuals, these people, initially I was thinking, what am I going to do? And the joy is they're the most approachable, kindest. Sitting in the lunchroom at the Meadows one day, and across from me was Pia Melody, and 2 seats down was Claudia Black, and over in the other corner was another. And I thought, somebody's going to find out I'm here and kick me out. But the truth is, they're the most approachable, wonderful people, and they're really passionate about not only what they do in their own work, but in supporting what we do in our programs. It's phenomenal.
That's amazing. That's very cool. I remember standing in an elevator at a sex addiction conference in Fort Lauderdale. This is back in 2014 or 15. I got into the elevator with Pat Carnes. I stood there, and this is 2014, so I've been in recovery. Well, I thought I'd been in recovery for 10 years at that point. Yeah. Boy, I was pooing myself just standing next to the great Pat Carnes, so I know how you feel.
Yeah. Pinch me.
Jerry, tell us about your staff. Give listeners and viewers an idea of the training and experience of your staff.
Yeah, we have one of the highest patient to staff ratios in the industry. We're actually licensed as a psych hospital, so we have to maintain that very high level of staffing. So all of my therapists are master's level and above, CSAT, Certified Sex Addiction Therapist trained. I have on my staff psychiatrists, on my staff psychologists, full-time trauma therapists, full-time primary therapists, full-time family therapists. We have a brain center in all of our campuses where we do neurofeedback. We use CES machines and HRV and real cutting edge brain healing technology. We have a continuing care coordinator full-time on each campus. And literally from the time a patient arrives, we're talking about next steps. We're not doing anyone any favors to treat them for 6 weeks and then offer a handshake and a good luck. So it's a multidisciplinary approach. The team meets every day to staff cases. We stay very informed on what's going on. Clinical directors at each program that supervise the clinical staff, director of nursing that directs the nursing staff. We are 24/7 nursing and behavioral health technicians on site. I mean, the staffing is phenomenal.
Jerry, that's amazing. Out of curiosity, with the heat that you guys struggle with in Arizona, do you get to do much experiential kind of treatment outdoors, or are you forced indoors most of the time?
We actually do. We within the system, we have our own equine therapy. We have our own ropes course.
Amazing.
And so that's within our system. And so even in the summer, we'll schedule those first thing in the morning. There's very rarely do we reach a point where we have to say, okay, at 8 o'clock in the morning, it's too hot to do that work. So we intentionally schedule them early. In the winter, we have much more flexibility because our winters are divine.
Beautiful.
The high of 80 and the low of 45, again, Fahrenheit. It's just wonderful.
Well,
but then we do yoga, we do Tai Chi, we do acupuncture, we do expressive arts therapy, we do movement and dance. We do those all in-house, and in the summer months we do them indoors, and in the winter months we can do it outdoors. So we don't change programming itself based on the heat. We just have to shift the times of day.
Amazing, brilliant, very clever. If ever I need to come back into treatment and I end up at the Meadows, I'll be coming in the winter, if that's all right with you.
That would be fabulous.
Jerry, what can a patient expect? You could take a day to answer this question, but just give us a brief synopsis of what a patient can expect from phone call to discharge.
Our intake staff is very, very well versed on being able to answer the questions on the front end. And then they're going to do a very in-depth screening. I'm going to ask what seems like an endless list of questions. Once that has been completed, that screening is going to be reviewed by a psychiatrist, a medical provider, the clinical director, and myself. We want to really make sure that this incoming patient comes to the right campus. They're in the right program. Once they arrive, they're going to go through an initial intake process. Within the first 72 hours, they're going to do a very comprehensive set of online psych tests, the SDI, the MMPI, the MCMI, possibly an ABLE, possibly a microcog, a whole variety of tests. Then our staff psychologist uses the results of those tests to help inform the treatment plan. Each patient has an individual treatment plan. They're going to meet with their primary therapist. They're going to go over that treatment plan. They're going to understand it and sign off on it. Then we're off to the races. And as I mentioned, they're going to get the Carnes model of treatment for the compulsive sexual behavior. They're also going to get the Meadows model treatment for the trauma. So it's very intensive. Our mornings start at 6 a.m. and lights out is about 11 p.m. 7 days a week. So there's a lot of work to be done. Now, of course, there's meals and recreation time and opportunities to fellowship. We are big proponents on the power of the community, especially the men who've been involved in sex addiction. They've isolated. They don't talk about this with anyone. They come here and they suddenly find out, you mean I'm not the only one? There's actually another man that I can talk to and say, I'm scared. So we really work on the building that sense of community so that when they do leave, they've got everybody's phone number and everybody's email address and they can stay in touch. So it's a busy 6 weeks. We sometimes say they get about 2 years of treatment in 6 weeks.
Sure, that's incredible. That's the entrance procedure there is, I'm sitting here mind boggled with how thorough that is. It's incredible to hear. on top of the client, Jerry, so a sub question to that is, what's the family involvement? What can a family expect whilst their identified patient is loved one is in therapy with you, and how do you interact with them?
We know that if the person doesn't go home to a family structure, a system that is getting their own healing, the likelihood of their recovery is jeopardized. So we have a strong family component. Now, pre-COVID, and hopefully soon, we'll go back to having a full 1-week family experience where the patient can invite a family member or two to come onto our campus. They're going to spend 5 days with us. Brilliant. They're not going to stay on campus overnight. They're going to stay in one of the local hotels, but they're going to be with us basically 8 to 5 days a week, where we do some intense work. It's not really family therapy. It's not couples marriage therapy. It's a workshop, a lot of psychoeducation, a lot of experiential work, a huge focus on boundaries and what does that mean? What are healthy boundaries? Because they don't have any experience with that. Learning communication skills. There's just a big, lengthy process that goes on during the week. With COVID, we've had to modify that significantly. We're not bringing family members on campus, but we are continuing to do just a tremendous amount of family work. Every patient has an assigned family therapist, and that family therapist is going to work with the family. Lots of phone calls, lots of emails, lots of involvement. We're going to facilitate phone calls with a variety of members of the staff, where the family can talk to the staff psychiatrist, the staff psychologist, their patients, their loved ones' primary therapist, the continuing care coordinator regarding next steps, the clinical director, myself, whoever is appropriate to help them. We're careful to help family members understand the person who is here is our patient. Mm-hmm. We're not your therapist, but we know we want to help you. And often we will then provide the family members resources where they can get therapy in their home. We might refer them, or their home area. We might refer them to a CSAT. We might refer them to one of our workshops, because we have 3 workshops that are specifically geared towards partner trauma. You know, the partners of sex addicts are different than the partners of a lot of other addictions because of one word: betrayal.
Yes.
They are experiencing betrayal trauma, and that's different. It's more than anger. It's a wounding to the very core of who they are. Why wasn't I enough? Why did he or she do that?
Well, I'm sure you're familiar with APSATs, and yes. I mean, they do amazing work, and they've helped me understand through my recovery over the last several years that it is now recognized that partners suffer PTSD.
Yes, they do.
In other words, it cannot be underestimated how devastating it is for the partners. Yeah. So yeah, that's good to hear. On the back of all of that, Jerry, how active and how proactive is the aftercare process, which kind of ties in with everything you've just been talking about? Yeah,
as I mentioned, literally from the day they arrive, we're talking about next steps. So I have a full-time aftercare coordinator at each of the programs, and that's all that person's job is wow. to be part of this multidisciplinary team and talking about, based on how the client is doing as they progress through treatment, what's going to be the appropriate next steps. Mm-hmm. Typically, we're going to give every client a minimum of 3 recommendations for aftercare, and that's going to be in tiers. If we, not these tiers, but TIERS, depending on the patient's need. Some patients need an extended time in residential care. So we network with programs all around the country that can provide that next step. Sometimes what they need is intensive outpatient and a sober living environment. Mm-hmm. Sometimes what they need is intensive outpatient back home. Sometimes, rarely, they're strong enough at this point to just go back home to their therapist and maybe see a trauma therapist in addition to a CSAT, in addition to a marriage and family therapist. So it's a very active process, literally from the time they arrive.
Amazing. That is a very, very thorough process indeed. We've talked about, funny enough, the next question says, how is treatment customized to a patient's needs? We've actually covered that in detail.
Yes.
I actually need to take that one out because it's a bit repetitive. So that leaves one more very important question, Jerry, which is talking about, I suppose, the future. And the question is, what are some of the greatest challenges the Meadows faces in a changing world? And let's not forget the one that the whole world is facing right now, which is called COVID-19.
Yeah.
But I mean, how are you guys dealing with that?
You know, when COVID hit, we went into a full court press. What are we going to do? How are we going to respond to this? And as everyone can remember, in the early days, it was changing daily, sometimes hourly. The CDC, the WHO would have new guidelines. And so we would shift protocols and procedures only to find out the next day, well, that doesn't work. Now we have to. So it was really an all hands on deck approach. I think the way we've handled it is extraordinary. Our doors are open. We've never for a moment not been busy. We had a couple of dips, but it's come roaring right back when unfortunately a lot of programs have not been able to survive. We've got tremendous safety protocols in place. Every patient is screened on the front end with a giant list of questions around COVID. And then the medical provider has to approve that patient coming in. When they arrive, the first 14 days, they must wear a mask. At the end of 14 days, if they're not showing any signs or symptoms, they can take off the mask. They're given a blood test upon arrival for COVID, again on day 3, again on day 7, and again on day 14.
Wow.
All staff is masked at all times, other than when we're online. Our sanitation procedures have been greatly enhanced. All the rooms are fogged with an antimicrobial on a regular basis. I mean, we are taking this very, very seriously. In the initial stages, we actually took one of our facilities and dedicated it so that if a patient comes in and tests positive, well, they can certainly go home, or they could move into this unit and do work while they are treated medically for their symptoms. So, I mean, we have really, I think, responded just extraordinarily well. So obviously the big challenge this year has been responding to COVID. Beyond that, it's staying current. Just because something worked in 1995 doesn't necessarily mean it works in 2020. So we're constantly looking at what we're doing. How can we improve? We don't want to just be out front. We want to be on the tip of the spear.
Well, however many decades ago, Dr. Spock was telling mothers that they should leave children in a crib to scream for 12 hours. And this is not the pointy-eared Spock. This is a real Dr. Spock. Yes. That may not be aware there really was a Dr. Spock.
Oh, yes.
His advice probably caused a few more problems than they solved. And we've moved
Indeed.
on. Jerry, it's been an absolute pleasure talking to you. And as I'm listening to you, I'm reminiscing about my time at the Meadows, which was very precious to me, even though it was now, 13, 14 years ago. Yeah. But amazing that you are still there, powering ahead, incredible attention to detail right across the board. And thank you so much for sharing it with us. Any final comments?
Just a thank you. Thank you, Mark, and thank you to everyone who's watching. As you can tell, I'm a little passionate about the work that we do here. And I believe
why it's still going.
Just one last comment. Prior to coming to work for the Meadows, I spent 12 years as an interventionist, and I took patients to treatment centers all over all over North America. And I was so impressed with the work that was being done at the Meadows that when they reached out to me about coming on board, I didn't have to think twice.
Jerry, with passion like yours, that's why the Meadows is still going.
Thank you.
Thank you so much. It's been a pleasure. Hope to see you post-COVID when we can give each other a hug at a conference or another. But
Amen.
For now, God bless and keep safe.
You too.
Thanks.